A 32-year-old man is brought to the emergency department after a foot injury while playing sports. He explains he was kicking a ball when he lost balance and put all his weight on the medial side of his foot, after which he started experiencing severe ankle pain. Which of the following is most likely to be injured in this patient? Choice A, deltoid ligament. Choice B, spring ligament. Choice C, anterior talofibular ligament. Choice D, posterior talofibular ligament. Or choice E, long plantar ligament. I'll wait 5 seconds and answer the question. So first, I'm just going to get it out of the way. The correct answer choice here is choice A, deltoid ligament. Now, there are two ways you could have gone about this question. Either you are an anatomy master, you read letters because you're bored and it's your hobby, or you try to apply a bit of logic here and just look at the names of these ligaments. Breaking it down into its bare essentials, you have the deltoid ligament on the medial side, the spring ligament or plantar ligaments, and spring ligament is also known as the plantar calcaneonavicular ligament. Well, you can think of those as more being on the inferior side of the foot, right? They're largely used to stabilize things like the longitudinal arch of the foot. And then on the lateral side, you have the anterior and posterior talofibular ligaments, as well as the calcaneofibular ligament. Now, when I say you can apply a bit of logic here, what I mean is, where do you think the ligaments that have fibular in the name are probably located? Probably on the lateral side where the fibula is, right? And spring ligament, well, if you think of springs, it's like how you jump. So it's kind of more on the inferior side, supporting the arch, and I guess it's supporting the talus as well. And the same logic can be applied to the long plantar ligament. I mean, it's kind of in the name right there, right? It says plantar. And then you're left with the deltoid ligament, which is probably the only one you actually need to kind of memorize that is on the medial side. And of course, this patient, the way the question is describing it, he is having an eversion injury, right? Which would damage a medial structure, which in this case is the deltoid ligament. So to sum it up real quick, deltoid ligament, medial, spring/plantar ligaments on the inferior side, and then lateral side, whatever fibular ligament. I know Netter has really pretty pictures that you can look at, but sometimes you could just apply a bit of logic here. I hope you found this video helpful. I'll see you in the next one.